Cancer of the cervix is said to be most common among women between the ages of 25 and 45. For many, especially the rural uninformed, think that cancer is incurable. But doctors say that if detected early, cancer is treatable. The challenge, however, the country lacks facilities in many hospitals across the country. For most of the doctors with no facilities to detect cancer, depend on guesswork basing on symptoms. In the southwestern districts of Kanungu, Kabale, Rukunjiri, the nearest hospital to all these is Kisoro Hospital, which has facilities to detect cancer of the cervix alone, meaning that all the other cancers are not screened in this sub-region of Kigezi. Annie Modest Budongo is a senior nurse at Kisoro Hospital Women Clinic, who has been at Kisoro Hospital for 7 years. She says, while they are detecting cancer of the cervix, they have no competence to measure its level.
Those ones who we suspect to have cancer after examination, we take off biopsy samples to send, and those samples are examined from here. They don't have a laboratory, they are no specialists. We have to send them to either private clinics in Kampala or to Mulago Hospital.
According to Budongo, of every 10 screened women, 1 is found with pointing signs of cancer. This she attributes to behavior change, as cancer of the cervix is a manifestation of sex contact.
We concentrate more on that cancer because it is 1, it's treatable when detected early. 2, it's just something that has to do with behavior, someone's behavior.
Because sex is a risk factor for cancer of the cervix, especially if you have sex with more than 1 multiple partner. 2, if you have had sexually transmitted infections, including HPV.
49-year-old Agatha Muzawimana has been screened with cervix cancer, and she is now undergoing cryotherapy treatment. She did not know that she had cancer because she had never had any pains to that effect. Because she saw many of her neighbors going for testing at Nyarusiza Health Center, she decided to join them, only to discover that she was a carrier.
Buri muntu wena utakechebezeho cervical cancer ashemererwa kuza mu irwariro bakamuchebera akareba nyemerere.
Most of them come when it has already advanced, and you can really see that maybe it is in where there are stages of cancer, so maybe it is like in stage 3, maybe it is in stage 4, and those ones basically they cannot operate.
A women organization, Action for Development, is championing advocacy for screening in Kisoro. They, however, say that gender-based violence is at the peak among women living with cervix cancer, as they are forced by their husbands to have sex, and when they resist, they are beaten.
Them being married and being engaged to these men who are demanding for sex. Imagine when a woman is in pain and is being demanded, and sex is being demanded as part of the conjugal rights of a woman in that relationship. When the men are denied, they'll demand for it by force.
While handing over an assortment of medicine to the cancer clinic at Kisoro Hospital, the Akford project manager said that the drugs and other medicines remain expensive, making it difficult for the average Ugandans to access treatment. They are now calling upon government to subsidize the treatment to save lives of women.